I am Jana Kimberly Q. Di Maun, first-year medical student, and I will be demonstrating how to conduct a general survey. General survey is conducted by observing the patient's appearance, height, and weight. And as we talk and examine them, we should also put our focus on the patient's mood, body build, and behavior. Make sure to greet the patient and introduce yourself. Good day, ma'am. I'm Dr. Jana Kimberly Q. Di Maun, and I will be examining you for today. May I know your complete name, please?
I'm Marciana Agustin Santos,
Your age?
67 years old,
And your birthday?
January 9, 1954.
Okay, can I start now?
Yes, doctor.
First thing to do is to observe your patient and describe the apparent state of health. Is the patient acutely or chronically ill? Is the patient fit or robust? Next, describe the level of consciousness. Is the patient conscious, awake, alert, or responsive to you and to the environment? Are there any signs of distress, such as anxious facial expression, labored breathing, coughing, sneezing, or any signs of pain? Based on our observation, we can describe our patient as a 67-year-old female in a apparent good state of health, is conscious, awake, responsive, with good eye contact, and no pain. Next, is the patient short, tall, or slender? Does the patient walk smoothly with balance and coordination? Excuse me, ma'am, may I
Yes.
request for you to stand up and walk a few steps away and to return. Okay, you may now take your seat. Thank you. Now we can describe our patient as patient is fairly nourished, height is proportional to the body is symmetrical, normal gait and posture, no abnormal involuntary movements, and of course, with no gross deformities. Now let us observe and inspect the patient's skin. What is the skin color of the patient? Are there any lesions, bruises that you can observe? Excuse me, ma'am, may I just check all your... Okay. Now we can describe our patient as patient is brown skin color with no obvious scars, bruises, or any lesions. Next, how is the patient dressed? Is the patient dressed appropriately? Is the clothing suitable to the environment, temperature, and weather? Does the patient have any unusual body or breath odor? Now we can describe our patient as patient is properly dressed and well-groomed with no unusual body odor. To summarize everything, we can describe our patient as a 67-year-old brown-skinned female, properly groomed and dressed, with no unusual body odor, and is in apparent good state of health, is conscious, awake, coherent, and responsive, with good eye contact, and not in pain. Patient is fairly nourished, with a height proportional to the body, normal gait and posture, and with no gross deformities. I hope you have enjoyed my presentation. Once again, this is Jana Kimberly Q. Di Maun, first-year medical student.